This is me injecting ozone. Ozone is a gas. This is 10 cc's of ozone. I'm on 80 cc's. Ozone is a gas that you can do intravenously into the vein that will act as a immune booster. It's stronger than any antibiotic. Oxygen is O2. Ozone is when you add another extra molecule, which makes it O3 or possibly O4, O5. We don't know exactly how many molecules are added, but when you add an extra molecule, it becomes what is known as atomic oxygen or ozone. So when you do it into the vein, you need to do about 10 cc's. Should take you, I think, approximately about 5 minutes. When you feel a tightness in the chest, that lets you know that you've filled up the body with ozone. Now, you have to understand this pretty well to be able to do it to yourself. But of course, I've been trained and worked with one of the best, which is one of the guys that actually used to work with Basil Wainwright. Now, I just filled up the 10 cc syringe. As I filled it up, you need a lure lock syringe so none of the gas will be able to escape. Then I take here and put it in, which is a 25 gauge needle. I tighten the lure lock, and then I begin to press. You don't want to plunge it all in there, but you want to take your time and slowly put it into the vein. It's going directly into the bloodstream, which will kill any bacteria, any viruses, anything that shouldn't be. The approximately time that ozone lasts in the body is only about 30 minutes. Just in case there is a ozone overdose, and all you need to do is take about 3,000 milligrams of vitamin C, and it will inactivate the ozone or neutralize it. I'm doing 90 cc's about now. I'm feeling a tightness in the chest. Of course, I've been doing this long enough that I've actually exceeded all the rules. I've actually done 200 cc's. I don't know whether I'll do 200 today, but I've done 200 cc's. It's basically just for preventative measures. But if someone does have a chronic sickness, certainly this would be one of the best routes to go. The side effects are so low for ozone use. Of course, there are people using ozone all over the world. The first ozone machine was made by a man named last name Viabon. His daughter is still currently one of the leading pioneers, Renata Viabon. And so, I mean, this can be very helpful. Several different diseases: cancer, lupus, arterial, flu, pneumonia, common colds, AIDS. Several different reasons that people use this all over the world. Preventive care just for boosting the immune system. I think this is 100 cc, and I'm now working on. Of course, all you do is get a vein, and once you get a vein, then you slowly pump it into that vein. If I was doing this on another client, then I would possibly have them laying down, because that way you're able to feel the tightness in the chest a little bit faster than setting up. But if you are going to be doing an application on yourself, then once again, you have to be able to kind of understand your body, to be able to know. I feel a tightness in the chest at 100 cc's. Of course, I did probably 20 other cc's, but I didn't really get 20 cc's because the vein that I had it in was allowing some of it to escape. So I changed veins and got another vein. You have the 100 cc, you unlock your lower lock, and then you have to lock it back on to the machine, where when I release the lever, the ozone flows, and ozone is a colorless gas. I think it would be blue though, if you could see it. I'm working on 110 cc's. Don't want to do too much movement. If you have help, I do have help here, but of course I don't need it. So, but certainly if you're not an expert in this, you certainly would probably need a little bit of help. For one, you wouldn't want to move that arm so much that you probably cause that needle to come out of that vein. And of course you'd have to start all over again. So this is 110 cc's. Which, if this was someone's first application, you probably would want to start to introduce it to their body no more than 40 or 60 cc's, 4 or 6 of these syringes full. And also, many times it can depend on the weight of the individual. I thank God that I actually learned the art of this, that I can pass it on to my children, that can pass it on to their children, that they will be able to take some type of preventive measures, or somewhat put their own welfare in not just the doctor's hand, but also they'll have a say in it. There are a lot of people that don't know the effectiveness of this. This is the 120, right? Yeah, they don't know the effectiveness of this, and so therefore they think that